So what's something unexpected that you learned in med school that wasn't necessarily medicine related?
Oof.
Because, like, for example, like most doctors and most lawyers, right? You know, they're not the best business people, right? You know, but is there something that maybe come to mind that you might have learned in med school that wasn't necessarily medicine related?
Well, I think one of the most interesting things I learned in med school, the curriculum kind of changed a few years before I got to med school.
Okay.
And they implemented something called problem-based learning, and where we would learn cases, whether they were, I remember the first one was breast cancer, and the second one was Crohn's disease, and learning from doctors in small groups, and sort of learning the practice of medicine, and not just so much the what it says in the books, but how to talk to people, how to be empathic, how to ask the question, do you have hope? And just instilling things like that in people, because without hope, it's difficult to see a positive future. And in medicine, that makes a lot of sense with things that cancer, chronic diseases. You always want people to have hope, whether it's faith, in God, in a higher being, in spirituality, just having hope. And so I remember that was one of the first lessons I learned in med school, thinking, wow, this has nothing to do with sort of science, per se, but it has a lot to do with, the humanism in medicine.
So teaching you the soft skills of how to communicate and have more sympathy and empathy.
Yes.
Interesting. Yeah. That's probably like 60% of the battle, right? Like how you communicate things to family members and manage the expectations of their loved ones. Huh?
Absolutely.
Yeah.